All right, today we're going to talk about something that affects millions and millions of people, but is, rarely discussed out in the open. We're going to demystify premature ejaculation. And we're going to skip the myths and just look straight at what the science and the data tell us about what causes it, and, much more importantly, what we can do about it.
So let's just kick things off with a number that might actually surprise you, up to 75%. So what on earth does that represent?
Well, that's the percentage of men who might experience premature ejaculation at some point in their lives. It is the single most common male sexual disorder. So, if this is something you or your partner are dealing with, the biggest thing to remember is you are absolutely not alone, not even close. But what exactly is it? I mean, we all have a general idea, right? But let's move from that sort of common feeling to how healthcare professionals actually define it in a clinical setting. At its heart, the definition is really simple. It's when ejaculation consistently happens sooner than a person or their partner wants it to during sex. And that definition really captures that common experience of, frustration and feeling like you're not in control. But for doctors and therapists, that definition needs to be a little more specific. So how does it go from being just an occasional thing that happens to an actual clinical diagnosis? Well, the official diagnostic manual, the DSM-5, gives us 3 really specific things to look for. First, there's time. The ejaculation almost always happens within about 1 minute of penetration. Second is duration. This isn't a one-time thing. The pattern has to be going on for at least 6 months. And third, and this one is maybe the most important, is impacts. It has to cause real significant distress. It's the combination of all 3 of those that takes it from an occasional issue to a clinical diagnosis.
So what's really going on here? It's so easy to just assume it's all in your head, maybe just nerves. But the reality is way, way more complex. The causes are this fascinating mix of biological stuff and psychological factors, and it's pretty much never just one single thing.
This is where it gets really interesting because these 2 sides actually feed off of each other. So on the biological side, you have things like abnormal levels of serotonin. Now, serotonin is a neurotransmitter that helps with your mood, but it also plays a huge role in delaying ejaculation. So if your levels are low, that can shorten the time. Then on the psychological side, that biological tendency can create performance anxiety and stress, which then makes the physical problem even worse. It becomes this vicious cycle where your body and your mind are kind of working against each other. Okay, but here's the really good news. Because we understand these different causes, we also have this whole toolkit of really effective strategies for getting control back. The journey to treatment is all about finding the right mix of tools for you. Generally, treatment follows this kind of 3-pronged approach. You've got behavioral therapies, which are all about practical techniques. Then you have pharmacological therapies, that's medication. And finally, psychological therapies, which dig into the underlying mental and emotional side of things. The best plans? They almost always use a combination of these. So first up, let's talk about behavioral therapies. Honestly, you can think of these like physical training for your brain and your body. They're basically practical exercises that are designed to help you recognize that point of no return and learn how to consciously put the brakes on. 2 of the most common techniques are called the stop-start and the squeeze methods. With stop-start, it's exactly what it sounds like. You just pause everything right when you feel you're getting close. With the squeeze method, you or your partner applies just a bit of gentle pressure right at the head of the penis. Both of these techniques work by interrupting the process, letting your arousal level drop, and just helping you build that awareness and control over time.
And beyond those 2 big ones, the toolkit has all sorts of other practical things. It can be something as simple as using thicker condoms to decrease sensation, or doing Kegel exercises to strengthen your pelvic floor muscles, which are super important for control. Even just shifting the focus to longer foreplay can do wonders to reduce that performance pressure.
Next up, let's talk about medical support. You can think of pharmacological therapy as a kind of scaffold. It can provide immediate help, which is great because it lowers the pressure and the fear of failure, and that makes it so much easier to actually practice those behavioral techniques we were just talking about. So the 2 main medical options are topical anesthetics, creams or sprays that just slightly reduce sensitivity, and certain antidepressants called SSRIs. Now, SSRIs can be incredibly effective because, as a side effect of boosting serotonin, they can significantly delay ejaculation. But, and this is really important to know, their use for PE is considered off-label in the United States. That just means that right now, there isn't a drug that is specifically FDA approved for this one purpose. And that brings us to our third pillar, psychological therapy. This is all about getting to the root of the issue. It's about addressing the anxiety, the stress, the dynamics in your relationship, or even past experiences that have gotten all tangled up with the physical problem. And this quote from a clinical review really says it all perfectly. While the other treatments are fantastic for managing the symptoms, psychotherapy is what offers the potential for a real, lasting cure because it resolves the underlying issues that are fueling that whole cycle. It's a huge piece of the puzzle. So with all these tools out there, the outlook is, well, it's overwhelmingly positive. Let's talk about that hope and what the next steps look like when you start combining these different treatments. So what happens when you combine all of this? You get this number, 85%. And this isn't just wishful thinking, this is a number that's grounded in clinical data on success rates. That 85%, that represents the potential success rate when you combine behavioral, pharmacological, and psychological therapies. This is exactly why a holistic, comprehensive plan is so vital. It's not about finding one magic bullet, it's about tackling the problem from every single angle all at once. Okay, so let's just recap the key takeaways here. First, and most importantly, this is extremely common, and it is highly treatable. You are not alone. Second, the cause is a complex mix of your body and your mind. Third, using a combination of therapies is really the gold standard for success. And finally, and this is so crucial, bringing a partner into the process with open communication can make all the difference in the world. When it comes right down to it, all of these incredibly effective treatments, the behavioral, the medical, the psychological, they all begin in the exact same place, with a single conversation. Whether that's with your partner or with a doctor, taking that first step, that is the most powerful move you can make. All right, today we're going to talk about something that affects millions and millions